There are many possible causes of malocclusion, including the size and shape of the teeth, the form of the dental arches, the relationship of the skeletal components, and a patient's own harmful habits. The cause of a disease or condition is referred to as its etiology. Identifying the etiology of your patient's malocclusion is essential for successful diagnosis, treatment planning, and prognosis. Selecting appropriate cases to treat will dramatically increase your chances of success. Some malocclusions are caused by major skeletal or arch length issues that can't be treated with clear aligners alone. But let's start small with dental problems. Here, we're talking about individual teeth. The shape of the teeth is known as their morphology, the form and structure of an organism or any of its parts. The morphology of teeth can vary greatly between individuals, but properly occluded teeth should mesh together like gears. Malocclusion can often be traced back to differences in the size or shape of the teeth. These differences can be very subtle. You may need to carefully examine and measure the teeth to detect them. Size and shape issues can include macrodontia, microdontia, anomalous teeth, supernumerary teeth, worn incisal edges and occlusal surfaces, and restorations such as implants, crowns, bridges, or veneers. Malocclusion is often accompanied by gingival issues, such as recession or notching at the cemento-enamel junction, and periodontal issues, like loss of attachment or loss of the interdental papilla. If we zoom out a bit, we begin to identify arch problems. These are issues with the morphology of the overall dental arch. The roots of the teeth are surrounded by periodontal ligaments, which connect them to tooth sockets in the alveolar arch. Orthodontic movement can only occur within the space available in the alveolar arch. Major changes to the shape, size, or position of the arch usually require additional procedures, such as surgery or growth modification. Dental arch problems can include insufficient arch length, which causes crowding, or excessive arch length, which causes spacing. The arch length can also be reduced by caries or tooth loss. The most common arch form is ovoid, meaning U-shaped, but different forms may be desirable for different face types. For instance, tapered, or V-shaped arches are generally compatible with narrow faces, while square arches are compatible with broad faces. Discuss any possible changes to the arch form with your patients to make sure they understand how it might influence their smile and facial aesthetics. If the upper and lower arch forms are incompatible with each other, malocclusion is likely to result. Of course, the arches are just one part of the overall skeletal structure, which we'll cover in our next video on skeletal problems.